I am Dr. Abdulkadir Mohamedsaid Gidey. I am a pediatrician and pediatric oncologist. I am working in the Kurambasa Specialized Hospital, which is a university hospital under the Addis Ababa University. I completed my fellowship in medical oncology in pediatrics in Tata Memorial Hospital in 2018 on December. Yeah, my study in India, I have, because before I went to India, I was just practicing oncology in Kurambasa Specialized Hospital. When I get the training in Tata, I have got a lot of exposures, because the number of patients that we see, that I saw in Tata is huge in number. There are different cases that can be seen and that can be discussed, and there was a good opportunity for me to have a good exposure in patients for almost 1 year in Tata. The other is instructors, the faculties are well known and they are ample experience, and they guided me, and they told me any different modalities of treatments and cases, follow-ups, and because of that I have gained a lot because of the patient load as well as because of the experts that are working in Tata. So after completing the course, I joined my colleagues in Kurambasa Specialized Hospital who are working in the hemato-oncology. Currently we are 3 hemato-oncologists working in Kurambasa Specialized Hospital. We have this is a big hospital, one of the biggest in the country, and we are serving for a lot of patients. And we see around 700 to 800 patients on follow-up and monthly basis. So this is a huge number. So because of my practice, I have gained a lot of it. I am refining my skill, what I gained in Tata. And also currently I am also the hospital is conducting a fellowship training program in hemato-oncology, and I am a faculty member in the training, and I am advising the students on the training, and I am currently also working as the head chief of the hemato-oncology division in the Kurambasa Specialized Hospital. Just the training, it's helped me to upgrade my knowledge on the pediatric hemato-oncology, and the other things that help for the patients. As you know, the population of Ethiopia is around 120 million. From 120 million, almost 60%, almost 60 million are under 15 years old. So there is a huge shortage of human resources that can manage pediatric hemato-oncology. So it's added for the patients, because the care can be taken by the trained hemato-oncologists that improve the care of the patient. This is one thing. The other thing is, because the number of pediatric hemato-oncologists in the country are few, a total of currently it is around 9, because we are working together, and we in the training and researches in the policy making of the country. So this helped us and helped the system to have a well established system, because we are working together, because my colleagues are in Jimma University, Gondar University, and in Mekelle University. So we are working together, and we are trying to establish a uniform as the same system. So this will help the country to use the same protocol, the same patient care. So it's also a good opportunity, because I got the training and I added on the system. Yeah, because when I trained in Tata, as I mentioned earlier, from other areas, from other country training, I prefer India Tata Center, because the reason is why. One, there are a lot of patients. You are directly involved in the management of the patients, so you will have hands-on training. So you will decide on the management, you will practice, and because of the diverse cases, you will have a lot of exposures. And during the follow-up of the patient, these are the things that you have to do, because you will see a new patient and you will see also the course of the patient's management, and during the follow-up there are a lot of challenges that arises, and this will be discussed. The other is there is MDT, regular MDT in the data. This is one of the areas that you will be exposed how to manage challenging cases. So these are the most important things that I have seen. I have friends who are trained in other areas, but because of the number of patients, the exposure is relatively low. That is why I recommend this program, because when you see a lot of patients, your exposure and skill increases, and you will have a good decision skills. I would like to thank Merck Foundation for giving me this opportunity and to contribute to my community, to the patients, and as well as to my training program, which is conducted in my university, in Addis Ababa University, in the fellowship training program. And just to add additional information, it is also, I recommend just if there is additional trainings, short course trainings, because science is changing, so updates is important. So those who are on the training or faculty members, it's better if they also get short course trainings just to update their skills and knowledge. I again thank Merck Foundation for giving me this opportunity. Thank you.